As I speak about these two issues, I'm really disappointed we're not taking this obvious major opportunity of acting on a major FDA bill to, again, not only have me speak, but all of us act together on the crucial issues of, number one, the reimportation of prescription drugs, and number two, meaningful generic drug reform so that we get generics to market sooner as a lower cost alternative for American consumers. And I want to touch on each of these in turn, Madam President. Madam President, I was glad to support my friend, the distinguished senator from North Dakota, and many Democratic and Republican colleagues in introducing an amendment to the FDA tobacco bill to enact comprehensive reimportation of prescription drugs. This has long been an issue that has truly united in a sincere bipartisan way Democrats and Republicans. Many Democrats, many Republicans have agreed on this. And I think it's important at a time when, unfortunately, the partisan divide and sometimes divisive and bitter partisan rhetoric is at an all-time high. It's important to find areas where we can bridge that divide in a meaningful and in a sincere way. It's important to work on real issues and real solutions together and bridge that divide. Reimportation is a great example of that. CBO has estimated that Americans would save about $50 billion, $50 billion with a B, over the next 10 years if reimportation were enacted. So we have a true bipartisan issue, which has true consensus support in the Senate, in the House, in the administration, which can save all of us and our healthcare system $50 billion. Let's act. Surely this is a recipe for something we can act strongly on and produce positive results. Madam President, I would underscore the same message with regard to the second crucial topic, reform with regard to generic drugs. For many months now, I've been working with several members, most notably Senator Shaheen of New Hampshire, on bipartisan consensus generic drug reform. Once again, I was very hopeful that this FDA bill on the floor of the Senate now would be a prime opportunity, an obvious opportunity to pass that consensus bipartisan reform. Once again, that door was closed to us. We're not going to have that opportunity, and I express real disappointment. But we need to act in that area, and I look forward to continuing to work with Senator Shaheen and Senator Brown and others in that important area. We desperately need important health care reform. We need savings in the system to make costs of the overall health care system more reasonable without sacrificing patient care, without telling seniors they can't get this treatment, they can't get that operation. These are common sense, achievable ways to do that by stabilizing the cost of prescription drugs. And that's one of the most significant costs in our healthcare system, with one of the most significant growth patterns. So let's act. Let's act on reimportation. Let's act on generics reform. Let's act in a bipartisan way. Let's act for the best interests of American seniors and the American people.